Hi, everyone. Good afternoon again, and thank you so much for joining us today for this call on healthcare in the face of hurricanes and COVID-19. My name is Becca Curtis-Heald, and I'm a senior manager here at the Clinton Global Initiative team at the Clinton Foundation. And this is the third of 5 calls that CGI is hosting this week and next that are highlighting some of the key challenges facing the Caribbean region this hurricane season. Chief among these, of course, is how programs and preparedness efforts must be adapted in the face of the ongoing COVID-19 pandemic. And today we're going to be talking about healthcare, which of course is a sector that has faced unique challenges this year, and is always one of the services that's most impacted by natural disasters. Today we'll hear from a really great range of speakers from different sectors who will highlight health challenges, including the ongoing pandemic, health facilities, adaptation and preparedness, capacity building efforts, and mental health care. Each speaker will have about 5 minutes of remarks, and we have a great Q&A period dedicated at the end so that you can ask them all questions, as I know they're all going to provide some really interesting information to us today. So please remember as we go throughout the program to enter any questions you have in the Q&A box, which is down at the bottom of your screen next to the chat function. Please put all the questions in the Q&A instead of the chat so that we make sure that we see them and can direct them to the right speakers. So our first speaker today is having some issues joining. So instead of Paho, I'm going to start with Melito Smith, who is the Executive Director of St. Thomas East End Medical Center in St. Thomas, USVI. And he will discuss with us today how his center's been operating this year and some priorities looking ahead to hurricane season. So Melito, thank you so much for joining us. It's a pleasure.
Good afternoon or good morning. I'm not sure what all the time zones are. And it is a pleasure to join. I thank you for this opportunity. Just to let you know, my name is Melito A. Smith Jr. I serve as the Executive Director for the St. Thomas East End Medical Center Corporation. We are a private, nonprofit, federally qualified health center located in St. Thomas, U.S. Virgin Islands. As many of you know, 2017 was a very impactful year for the Virgin Islands and Puerto Rico, as well as certain other jurisdictions in the Caribbean, as well as on the mainland United States. The Virgin Islands, both St. Thomas and St. Croix and St. John, had the distinction of being hit by 2 Category 5 hurricanes within 2 weeks in the month of September. As we fast forward to 2020, we across the world, including the Caribbean, are faced with the pandemic known as COVID-19 coronavirus. So in that context, I would just like to give some quick remarks and then open for questioning at the proper time. In our preparation model, we are currently taking into consideration the impact that the storms have had on our ability to shelter individuals in the Virgin Islands. Just about most of our public infrastructure had been severely damaged. And with the COVID-19 now, there is drastic requirements for social distancing, which will make it very difficult for many individuals to be sheltered in public spaces in the numbers and quantities as once before. So as a health center, we are doing certain things to mitigate that in conjunction with our local health department, as well as the state emergency management entity. One of those things that we are doing is preparing care packets for both COVID-19 related items, as well as hurricane preparedness, hurricane prep items for our patients. We have identified using analytics the most high-risk patients and have prepared packets and have reached out to them through both a telehealth, which most folks have moved to telehealth or telecommunications in some form to contact and stay in touch with our patients, as well as some outreach that we have begun. We have prepared our staff and ensured that we have proper PPEs, and globally there is a shortage, but we have did as best as we could to ensure that we have proper PPEs for our staff and provide all of our patients with PPEs to the degree that are necessary for them in terms of masks, etc. We have a high number of hypertensive as well as diabetic patients that we serve. We have a high geriatric population, and as you add those things together, you know that those are some of the most high-risk individuals for COVID. So we have done a number of things to stay in touch with those patients and also to provide services. We also have restricted the as many patients from coming in. We have moved to a telehealth, more of a telehealth model, and also have implementing screenings for temperature and other items as requested and required by the CDC, and set up surge areas to keep individuals who may be COVID symptomatic out of the center, but in areas where they can be treated. So far, throughout the territory, our numbers have been relatively low. We're anticipating that those numbers will increase perhaps as we open our borders, which just happened on June 1st. So at this time, yeah, I would yield and allow for the question and answer time as when that's allowed. Thank you so much, Becca.
Great, thank you so much, Melito. This is really helpful to hear your perspective here. Just one quick follow-up question before we move on to the next speaker. Would love to know, in terms of partnerships, if there are areas that you're particularly concerned about or prioritizing ahead of this hurricane season, where the center is seeking partnerships from different types of organizations that might be on the call today.
Well, we're always seeking partnerships, particularly now in the area of well, we have a strong partnership, I like to say this, with Direct Relief and AmeriCares. You know, we have those partnerships have developed since the storms of 2017 and have continued. And I'd just like to give a big shout out and thank you to those two organizations who have continued to be extremely supportive of the work that we do. There's always a need, particularly now, for personal protective equipment. You know, that is a ongoing need around the world, but I know it's even more so in the Caribbean. Yeah. While we are American, we're still American Caribbean, and the challenges of procuring those are compounded based on our distance from the mainland. So that's always a challenge. Secondly, is just to maintain a good, open, and continued relationship with all the partners who are on this call and those that we continue to stay abreast with through the Kinton Initiative, so that in the time of need we can reach out. This is anticipated to be a very active season, a very early season. It began in the month of May, and everyone's doing what we can with the unexpected. So those would be the things that are highest of mind to consider for partnering.
Great, thank you so much for that. That's really helpful to know.
Thank you.
Perfect. And if, again, a reminder, if anyone has questions for Melito, please enter them in the Q&A box and we can address more towards the end of the call. So thank you again.
You're welcome.
Now I'd love to move to our next speaker, whose name is Rob Frenney, the CEO and founder of Adaptive Architecture and Planning. So staying with the theme of health facilities, preparedness, and adaptation, Rob is going to share a great resource that they've developed with partners to help spaces be designed and adapted for treating the ongoing COVID-19 pandemic. So Rob, it's great to have you with us today.
Yeah, thank you, Becca. I appreciate being here and sharing what we've been able to accomplish. So we developed a COVID-19 response unit in association with our partners, HDR, Design for Others and Construction for Change. And to get right into sort of the intent and the intended users of that document, the intended users are healthcare providers in developing areas with the intent to assist them on developing strategies for COVID-19 response. And the intent of the document is really to provide clarity on the layout of space, critical components and adjacencies of a response unit, and the critical flows needed to provide high quality care and safely reduce the spread of the virus. Could you flip to the next? You can go one more actually. So, in speaking with many partners, we made some high level assumptions. The primary assumption is that many of the partners we discussed, what their challenges were is that they didn't have the capacity to take on the potential surge of new COVID-19 patients, considering their existing healthcare facilities are overwhelmed with pre-existing conditions. So in this document we developed, we made the assumption that many of these facilities are going to need an additional capacity to get up to where their needs are for the COVID-19 response. So we sort of, as architects and planners, we took a step back and thought about what we've done in the past. And this here we're sharing is a maternal health prototype, which is a design for a challenge that's been identified by many partners. It's one solution to a challenge, identifying critical flows, critical spaces, sizes of those spaces and adjacencies in a plan. And we put that out in 2017. And what we've seen as a result is at least 5 of these have actually been implemented. And we're continuing to push that out. Next slide, please. So we decided to focus on this idea of developing a prototype specific to COVID-19 and a checklist that goes along with that. So from the left to right, we organized with CFC and HDR, a group of architects, planners, local healthcare specialists in the region, to really pull them all together in this collective platform to develop a prototype with the intent to push that prototype out to as many local implementing health organizations as possible. And the far right, that's sort of showing the maximum impact that we're hoping to make with one prototype document. Next slide. So this is getting into the specific COVID-19 unit that we developed. And as you can see, it really focuses on what the components are and what the needs are to develop a safe and well-functioning COVID unit. Next slide. And beyond critical adjacencies, the flows are critical to a well-functioning unit. So on the left side, we're mapping out critical flows for patients coming in and out, patients traveling from a suspected ward to a positive ward, the potential of deceased patients, how you move them out of the unit, and perhaps most importantly in the center is how you move staff into the unit and properly put on PPE before entering the unit, and even more important, how they properly exit the units, really trying to keep staff as safe as possible. And even more important on the right side, how you bring supplies into the unit and how you push the waste out of the unit. Next slide. So in addition to the specific unit, there's critical network components that are needed to support a well-functioning COVID-19 unit. So we documented as many of those network components as possible and listed them here, just to make it clear that any organization that is trying to respond to COVID-19 needs to consider all of these components as well. Next slide. And working with Construction for Change, they did an incredible job at looking at 3 different options of converting existing facilities to be used as COVID-19 units, or constructing new facilities with tents or with local materials. So the graph on the bottom, apologize for it being pretty small, but it really looks at the construction timeline and the associated cost, so that partnering organizations can use this as a tool to look at, if you have 8 weeks to make a response to COVID-19, you may have to fall into the retrofitting existing or tents. and at what cost. Next slide. We wanted to point out that flexibility and expandability for all COVID units is critical. Nobody knows how long this pandemic is going to last, and all of the facilities being implemented right now are designed specifically for COVID-19. But as implementers and healthcare specialists and architects, I think we all collectively need to be thinking about how can these facilities be used in the next 2 years, the next 5 years, the next 10 years? How do we design that flexibility into these systems so that it can be used for multiple things in the future and not, remain a stagnant facility? Next slide. What is next for us? We're continuing to identify partners in the international healthcare world that we can help make a difference. We're reviewing lots of plans and implementing numerous COVID-19 units. But as the world transitions from sort of this emergency disaster phase slowly into this transitional phase over time, we're looking forward into reconstruction to understand how to develop resilient systems and how we can provide services to help healthcare organizations, communities, educational organizations in developing those resilient systems. Next slide. So I'd like to open it up to questions and also want to note that my colleagues, Timothy Hickory from Construction for Change and Jason Emery Groen are also on the call to answer any questions. Thank you.
Thanks so much, Rob. That was really great and just great to see what you guys have been able to develop in such a short time. One quick follow-up for you now. I know there's a lot of organizations on the call who are health responders or run health facilities, but there's also many who work in community centers in different settings. Do you think that some of the sort of parameters and critical components you outlined there can be relevant even if you're not in a more formal health space?
Yeah, if you look at the critical components of the flow specifically, we're working with some restaurant organizations, starting to work with some schools in our area specifically, and the flows are all very similar. You want to think about how potential infectious patients are entering the facilities, how you keep staff safe, and the movement of supplies and materials. So this as a healthcare specific document, I think can also be used for multiple other uses.
That's great. Thanks so much for that. And definitely think there's so much that so many people can take away from that on this call. So really appreciate you sharing. And for attendees wondering, we can certainly make the PowerPoint available to everyone after as well. And we'll have time for more questions for Rob and his colleagues as well at the end of the call too.
Thank you, Becca.
Yeah, thank you. Perfect. Now I'd love to move to Tom Cotter, the Director of Emergency Response and Preparedness, who's with us here today from Project Hope. And he's going to talk about something that I think is really important for us all today. And I know something that's been on everyone's mind, which is how are the COVID-19 restrictions going to impact the ability of international response organizations to respond in the Caribbean in the event of a major hurricane this season. So Tom's team has been working on many things to sort of mitigate these issues. So I'm really excited for him to be with us today and to share some of what they've been doing. So welcome, Tom.
Thanks very much, Becca, and thanks to CGI for hosting this. I think it's a really important conversation that we couldn't have enough of in sharing some practices and some lessons learned and suggestions as a community. I want to get right into it, which is, your original question is how is the new COVID realities going to affect INGOs and our emergency response capacity? And the answer is quite a bit. And I think that there's no real getting around that. And there's two main reasons for that. One is the travel restrictions, of course. But the other one is when we think about sending responders, specifically responders, personnel, into disaster areas from the United States, we have to consider whether or not we're potentially exposing communities to additional COVID based on what our profile is right now as a country. recognizing not everyone comes from the US, but I think a fair amount of responders do. So Project Hope, what we're endeavoring to do, and what I think our challenge is and has been for quite some time, and we've been working towards this, and the new realities have put this at the forefront of our efforts and really highlighted how important this is. We're determined to decentralize our emergency response capability. We have to get away from everything coming from the US, both personnel, donors, and equipment, and figure out ways that we can empower not only communities, which we do, and I'll talk a little bit about, but also internally. How do we decentralize it? I'm the director of emergency response, but I don't necessarily want all emergency response activities to come across my desk and to be managed by me. I want it to be managed closer to the communities that it's actually affecting, and by community members themselves whenever possible. So let me get right into it. Part of what Project Hope has been doing is developing regional emergency response capabilities. So instead of, again, as I said, our headquarters is in Washington, DC, as is the headquarters of a lot of INGOs. And we want to figure out how we can deploy instead from places like Jakarta, places like Puerto Rico or Colombia, and stage responses from there to cover a whole region. And what that means is building capacities within our internal structure, within our colleagues, and finding donors, which I think is the tough part. And I'll talk a little bit about sensitizing donors, but we have to sensitize donors to give us preparedness money that may be different than is what is expected or what has been done in the past. We build capacity always at Project Hope as a key aspect of our emergency response capabilities. And I think that is becoming more and more important because we can't be everywhere at once, and where the places we can go are shrinking by the day. We do this in a couple of ways. I think there's a great movement to include training and capacity building in emergency response. I think there's a way to take that even further and make this a train the trainer approach. We're not only training now cohorts of people in countries that were affected, in places that were affected. We want to empower those communities to then go out and cascade this even further. And we've got an initiative right now for COVID healthcare system response and preparedness that has trained globally right now about 25,000 healthcare workers, which is a number we could never achieve if we just had our team of trainers and went out. But by doing it a train the trainer, it allows for more coverage and more empowerment of the communities we're helping. And we've also established regional training teams. One of them is in Latin America, Caribbean. It has colleagues from the Dominican, Puerto Rico, and Colombia and Ecuador, and we're rolling that out regionally right now. We also, we've done initiatives where we have, in Puerto Rico after Hurricane Maria, Mr. Smith spoke about the 2 Category 5s that swept through those territories. Part of what we've always done is try to build infrastructure. So in Puerto Rico specifically, we built a cold chain that was then hurricane resistant, which allows the rapid deployment of cold chain resources after Puerto Rico is hit, and it decentralizes out of San Juan, certainly decentralizes it from the mainland of US. So that can help, because that will allow people who are there already, and again, just empowering the communities that are being affected directly as a response to COVID to mount a better response. I'll move on. We're also, one of the things that we're doing now is recognizing through our planning efforts, our contingency planning efforts, that we need a better network of local NGOs that we can partner with during disasters. And so, for example, when Bangladesh was hit by Cyclone Amphan, I think it was 2 weeks ago at this point, we don't have a presence there. Project Hope doesn't. We have a lot of regional offices there. We have 14 country offices, but we don't have a presence there. So instead of sending a team in, we quickly identified a local NGO that then we could partner with and leverage our donor networks, leverage our technical assistance, and leverage our partnerships with other NGOs to get them on the ground up and running faster and potentially better than they would have without our partnership. So we're going to be doing that throughout the Latin American Caribbean region. Now, part of what we're doing, and I mentioned the training opportunity, but we're also leveraging this international global training network that we've developed with our early COVID-19 healthcare systems training to launch other training initiatives. So right now we're building a community healthcare worker initiative in Ecuador that then we can scale and promote throughout our networks. We're building a mental health care resiliency curriculum and toolkit for healthcare providers specifically, and being able to launch that throughout our curriculum, through our infrastructure. And so we're really excited that COVID, because it's changed the nature of how we respond, it's given us different opportunities to build capacity and build resilience and build response readiness throughout the world in ways that we didn't have before. We also have looked at different technologies. So we're partnered with Project Echo, where we're delivering with a couple of partners virtual trainings in Puerto Rico to build preparedness and to build awareness around various health topics that after an emergency, after a sudden onset disaster like a hurricane, we can stand that network up and host different content. Likewise, we're partnering with an organization called Weissman to provide telehealth services. And we've started piloting this in Colombia and Ecuador, where providers in the US can actually provide consultations to doctors and nurses in these countries and provide subject matter expertise on caseloads that they're seeing and specific cases that they're seeing. So again, not a technology we'd used heavily in the past. We'd certainly been aware of it. We've been admiring it for a while, but we're really using this in earnest now. And I think just lastly, Project Hope, we found ourselves very early on the front lines of this response because we have an office in Wuhan and we have 3 other offices within China. And so we've been able to leverage a supply chain network exporting from China to deliver to partners within the US, within Latin America, Caribbean. So far we've done Puerto Rico, Dominican Republic, Ecuador, Colombia, Mexico, among others. And we want to make sure that that stays healthy so that we can be agile and meet the PPE needs after another hurricane hits. And I think, and I'll pause for questions, but I think my last statement is just, we have to be aware that there's going to be the impact of the hurricane, but the slower burn is going to be the impact of COVID in communities. Mr. Smith talked about difficulties of sheltering. We have to make sure that we're prepared to do the first wave, which it will be the more direct impacts from a hurricane, but then the second wave, which will be a slower burn. And with that, I will end.
Thanks so much, Tom, for sharing that super helpful information, and really applaud you guys for what you're doing to adapt and ensure preparedness through different means than we've relied on in the past. So it's really great to hear of all these efforts. One quick follow-up question that I would have for you is sort of, if others on the call are interested in doing similar things with capacity building and sort of reducing that reliance on external teams coming into the region, where would you recommend that they start, or how would you recommend that they partner with you all to kind of expand these efforts?
Sure. Project Hope has a lot of resources. All of our training is online on our website if you want to go see it. Mm-hmm. If you want to have an in-person TOT, get in touch with my colleague Andrea Dunsosa, who's on the call, or myself. Great. But there's a lot of resources out there. And I think that the key part of this is starting to pick some. And I think that might be part of the problem, is that there's too much. It's like when you have a book report and it's any book you want, it's hard to pick just one. Sure. We have to start picking our resources and implementing them. And there's a lot that we can find local partners and empower them with the materials that already exist. I think another part of that, especially in the Latin America, Caribbean region, is making sure the translations are readily available. And so ensuring that this is accessible to all and there's no barriers to both our organizations, but also our partners on the ground to implementation.
Yeah, perfect. Thank you so much. Really appreciate you sharing this. And again, we'll have more time for Q&A at the end, so keep submitting those questions in the Q&A box. So now I'd love to pick up on something that Tom briefly mentioned during his remarks, which is the issue of mental health. And of course, for those of you who've engaged with CGI for a while now, you'll know that this is one of our main focus areas of the Action Network for the past 2.5 years. So after seeing the mental health issues after the 2017 hurricane season, this became a major focus area for us. And I know that we've all observed that mental health issues typically spike at the beginning of hurricane season. And now this year with COVID, obviously there are a variety of layers to this issue. So I'm really pleased to have with us Dr. Yasel Ambert from the University of Puerto Rico. She is a psychologist and clinical supervisor with the Proyecto Patria program, which is a partnership with the University of Puerto Rico and Hispanic Federation. So really excited to have Dr. Ambert here to talk a little bit about their community mental health programs.
No, perfect. Good afternoon. Thanks for the opportunity of presenting the project Patria. We are a partnership between the University of Puerto Rico and the Hispanic Federation to develop, implement, and evaluate a prevention and intervention mental health project to deal with the aftermath of Hurricane Maria in Puerto Rico. Patria is a partnership name, is an acronym which stands for Project for Empowerment, Transformation, Recovery through an interdisciplinary approach of accessible services. Through our project, we have impacted 4,000 people that received services of the project this last year. On the second slide, we are going to give you an overview of our project. It's a multi-level service project intended to provide accessible services. They are offered in 3 levels. First, we are in 3 UPR campuses, is the first level. We work with 9 selected community-based organizations, and through home visits, that is our 3rd level. Also, on the triangle that you can see in the presentations, is that the project also has as a goal to build capacity of the local mental health sector to prepare and respond when another similar event happens in the future. Under proper supervision, our graduate students are available to become experts in natural disasters, mental health, and once they graduate, they can become leaders in the field. The short and long-term goals are to have a cadre of professionals well-trained in mental health disasters that can better address the needs of the population. So that's an overview of our project. In the other slide, we have the challenge of work continuity with COVID-19, and with the work continuity is fundamental for organizations like ours that provide psychological aid to the persons affected by a disasters. That's why preparedness is fundamental. Even though as a project, we have a plan of preparedness for natural disaster, we were not exactly prepared to face the challenges of social distancing. As an organization, we had to make an assessment of our resources. For example, human resources by taking care of the mental health of our team. Also identifying resources that were available to us. Also, the process of communication, constant communication with the CBOs to know what were their immediate needs, how can we support them, and currently continue giving services. And it has been a challenge, and we have to adapt as a project. That's why we are talking about what's the organizational resiliency, because we have to adapt the services and cope with the challenges of these last years. And the process of adapting, we have coped with these new changes by immediately starting working in converting our seminars in an online format and including new relevant information about mental health during social distancing. We have 11 very relevant topics, which include stress management, gender violence prevention, compassion fatigue, burnout, and self-care, among others. Also, our staff have been trained in telehealth and psychological first aid. To overcome the requirements of social distancing, but keeping providing free accessible mental health care services, we designed a helpline that will have responders from Project Patria and graduate students from other mental health programs of the University of Puerto Rico. In the second phase, we will start providing teletherapy And also at the moment, we are acquiring cell phones for the grad students that have the will to work in the line, but don't have the means to integrate to the work of Project Patria. In the other slide, we want to share the concerns and the plans regarding this hurricane season. We are dealing with mental health, social and economic of the three events, Hurricane Maria in 2017, which we are under recovery yet, the earthquake that began in December 2019, and that continue at the southwest area of the island, and now with the COVID-19. Each one of these three events have had a significant impact in the well-being and quality of life of the population. Certainly, the government of Puerto Rico has limited resources, particularly to deal with the preparedness issues for this hurricane season. We see a reduction in available services, particularly for the most vulnerable population, which includes persons with functional diversity, older adults, and poor people. Also, a lot of infrastructure has suffered damage both by Hurricane Maria and by the earthquakes. For example, currently many houses are not in condition to resist a new disaster, and some schools that had served as shelter were destroyed by the earthquake. As a result, we anticipate an increase in the demand of mental health services. A large part of the population is worried about the possibility of a new natural disaster. And Patria plans are to address this need by continuing the delivery of free mental health services through virtual platforms and, when possible, in-person services. In this point, it is very important our collaboration with the CBOs, because they know the needs of their communities and allow us to provide services from their facilities. For our remote services, we are identifying which technology, equipment, the CBOs may need and the project may supply. We are sure that Patria can contribute to breaking the gap between need and accessibility to mental health services in Puerto Rico. Our aim is the continuity of the project for more years to serve our population. However, Patria has financial support for the second year, but we are working in obtaining additional support to extend the project beyond this second year. This has been an overview of Patria and the plans we have, plans that we are thinking we are starting to overcome these new challenges. Thank you for your time.
Thank you so much, Dr. Ambert. That's great. And I really applaud you all for all the ways that you've adapted the program, because we know it's obviously so important to continue these services. I want to ask a quick question before we move on, which is, I think the way that you guys have embedded in community-based organizations in the island is a really unique and special thing about this program. Mm-hmm. Can you say a little more to everyone on the call about sort of why that's so important and why it's been successful?
Yes, we have embedded giving services with community-based organizations. That have been very important for us, because the CBOs know the needs of the communities. People trust the CBOs, the community that have been working for long years with those communities. So Patria have entered and have the trust of the participants of the community, just because the CBO give us like this way of entering to the community. So for us, that have been fundamental of making possible and accessible the services of mental health, knowing that there's a lot of stigma on mental health services, but the community-based organization have the trust of people, and that's how people are reaching the services of mental health of Project Patria.
Perfect. Thank you so much for that. That's really helpful. And I guess for people on the call who maybe want to provide or integrate mental health more into their programs, what do you think is sort of the best way to start to integrate mental health into an existing program?
I think that integrating mental health, we have identified that having a strengths-based approach, it's very important to people. And just, we have not talked about mental health with our participants. We talk with our participants of well-being and quality of life. So we make like a turnover on the approach we're making to people. So if we approach people that you need a mental health service, maybe that people have the stigma of the services, and maybe they don't identify they need the service. But when we talk about well-being, quality of life, then people start being more receptive to receive the services. And also going to the visiting homes, being in the community-based organizations, make the services more accessible. So we are not at the campuses of the university waiting people to come for us. We are going to the places where the people are in their communities, and there people feel more comfortable and less judged that they are receiving services. And the focus of just trying to get a better quality of life, I think all of us want a better quality of life through our mental health.
Yeah, exactly. That makes a lot of sense. And it's definitely a really good approach and great point to bring up about sort of the way that stigma plays into all of this. So thank you for that. So thank you so much for that information. And we'll take more questions for Dr. Ambert at the end of the program as well. So now it's my pleasure to welcome another speaker who will address the topic of mental health. It's Miguel Marrer from AmeriCare's Puerto Rico team. And he is the mental health and psychosocial support lead for AmeriCare's in Puerto Rico. And they've been doing some really incredible work over the past few years since the hurricane and the earthquakes, supporting mental health on the island. So I'm really excited to have Miguel here today to talk about specifically the mental health needs of our frontline health workers, and how they've been working with these past months and looking into hurricane season. So welcome, Miguel.
And thank you so much for this opportunity. I really appreciate to be here sharing with all of you. I have seen a lot of really important people for me here participating as panelists and as part of the participants. So thank you for this opportunity. So yes, I'm going to be talking a little bit about AmeriCare and how we are providing mental health support to healthcare workers here in Puerto Rico. So next slide, please. Just a little bit about AmeriCare for the one who don't know us. We are a health-focused relief development organization that responds to people affected by poverty or disaster with life-changing medicine, medical supplies, and health program. Since it was established maybe more than 40 years ago, AmeriCare has provided health and support to more than 164 countries, including the United States. And this here, in this slide, you could see our program focus, that related to access to medicine, emergency response, clinical service, and community health. Next slide, please. Here in Puerto Rico, and considering this pandemic, the COVID-19 situation, AmeriCare responded to the emergency in multiple ways, including capacity building for health provider, responders, and community leaders. This response was based on 4 main pillars that are preparedness, infection control, education and health promotion, and mental health and psychosocial support. Something that is important to note is that when we embark on this response, like many others that are here in this activity today, we were in full response to the earthquakes that started in January 2020. And at that same time, we were facing work on the recovery process of Hurricane Maria. But we will talk a little bit about this later in the presentation. Next slide, please. In the area of mental health and psychosocial support, our mental health team has been working on the response in a couple of different ways. The main concentration was the development of material and implementation of psychoeducation in multiple areas, capacity building in multiple areas of mental health through the webinar modality. 12 different webinars were developed covering multiple areas, like, for example, like emotions and management, coping, stigma, infodemics, self-care, psychological first aid for adults and for children, grief also for both population, sleep hygiene, among other different topics. On the other hand, a need that we saw in the community of health workers and began to work with them was the emotional support and accompaniment for responders, health providers, community leaders, and behavioral professionals. Next slide, please. Regarding the numbers of people impacted through training, this graph shows how the interventions of Americans in Puerto Rico have been adapting according to the need of the stages of the emergency. As you will see in the initial stages, maybe more related to the month of March, our response went hand in hand with the need for knowledge and education of aspects of health, more public health, knowledge, epidemiology, with the priority being the education and promotion of health about the values of the providers. We see how later there is a movement towards psychoeducation, capacity building in the area of mental health. When you see the graph there in the month of May. Another detail is that we see how preparedness number began to rise in the month of May. And this responds precisely to the beginning of the preparation process for the combination of COVID with our hurricane season. The June numbers include much more mental health interventions, and the growth of preparedness numbers continues. Next slide, please. Here, this graph, we see how efforts have been distributed in the response of Americares Puerto Rico, concentrating in the capacity development of psychoeducation, support and containment, and the area of mental health, with 54% of the activities and interventions. Next one, please. The previous numbers only include until the month of May. However, by updating those numbers as of June 5, as of today, we have managed to impact through psychoeducation, workshops, and accompaniment and support sessions for mental health, for responders, health providers, more than 5,000 health providers, first responders, and mental health responders have been impacted with our activities. Next, please. As I mentioned before, and many of you know, and also the last presentation also talked about this, Puerto Rico has been affected with multiple emergencies and natural disasters in recent months and years, such as epidemic, earthquake, and hurricane. And people experience emotional distress, especially health providers. 3 years ago, we got the Zika epidemiological emergency, then Hurricane Maria, and now we still, we're working at the same time with the COVID and with the earthquake. When we talk about infectious disease outbreak, epidemics, and pandemic, we should understand that it also brings strong emotions in people. So now we are dealing with a combination of an ongoing pandemic and what is expected to be a very busy hurricane season. So next slide. So anxiety, stress, and depression increase in the population and among healthcare providers dealing with emergencies like those that we talked before, and the expectation of an active hurricane season. The restrictions and guidelines established by the government and health experts limit the access to services and products related to future emergency preparedness. Another limitation because of the current emergency is the cabin fever syndrome, in which people limit themselves to go out to get prepared for hurricane season due to COVID-19 exposure. This contributes to the above-mentioned symptoms emerging more quickly and more intensely. As part of the actual emergency response process and preparation for future emergencies, considering the beginning of this hurricane season, the following workshop, the one that you could see in the slide, have been developed in webinar format. And they are addressed to first responders, health service providers. This training provides strategies for personal use and to implement them with the population to which they are offered. We include webinars related to psychological first aid, resilience and coping strategies for healthcare providers, emotional aftermath of COVID dealing with the new hurricane season, grief and loss vulnerable populations, and self-care. Next slide, please. thank you very much for this opportunity. And if you have any questions, please feel free to let me know.
Hi, Miguel. Thank you so much for that great presentation. It's so awesome to hear about all the really impressive work that your team has been doing. So thank you for all that you do. I know you've been working hard for months now with the earthquakes and COVID and everything. So truly, it's really impressive. One question for you. One thing I'd love to know is sort of, you talked about, the anxieties and different stresses that are placed on healthcare workers, especially. And how have you seen those have an impact on the communities they serve in terms of their ability to provide care? Sort of what's the relationship there?
That's a very interesting question. Yesterday, I was working with a team in webinar, and I was telling them that 60%, according to one study, 60% of clinicians, of doctors and nurses, get really stressed, really high levels of stress and anxiety because of all of these situations and the work that they do. The most interesting part is that the majority of them does not look for help. And then what happened is that they are getting burnout. A lot of what we call vicarious trauma or secondary trauma, they get really affected, and that get them tired and get them physically affected, but also affect them in the decision making. So there is a lot of things that have been happening with that population, and that's why we at AmeriCares have the health providers, first responders as a priority target when we talk about mental health.
Great. Thank you so much, Miguel, again. And if anyone has more questions for him, please put them in the Q&A. So now I just want to take a moment to thank all of the speakers so far. I think you've all provided such interesting and actionable information to everyone on the call about a number of really important issues. So really grateful for your time. So now we'll move to Q&A. So please continue putting your questions in the box for us. And I'm going to start with a question here. Let's see, we'll start with a question for Tom from Project Hope. The question was, what kind of technology are you actually using to achieve your remote training and train the trainer project? And a second follow-up to that is, how can we partner on your virtual trainings in Puerto Rico or participate in them?
Great, it's a good question. So we're using the usual suspects of video conferencing for it. The way we're setting it up, actually, because we want to get as many people trained as possible. So these are TOTs. So we're having one instructor manage the Q&A part while the other person's live instructing, which makes it really dynamic and interesting. But we also recognize that there's limitations to this technology. We want to be in the places where there is not reliable internet, where there is not reliable electricity, which is why I think the TOT model is going to be particularly important in the coming months for this. Because then once we give the training and we give the materials and an instructor manual, we encourage our new trainers who went through the original TOT to localize this, to contextualize this, and then go to the places where we can't go. And so I think that's the more important part. Thanks.
Yeah, that's a great point. And then the follow-up question to that, which was, how can people participate in the trainings if they're in Puerto Rico?
Absolutely. So my colleague, Andrea, is on the call. She put both of our email addresses in the chat. People can reach out to, I think Andrea is going to be a better person for you to reach out to, but feel free to copy me on it.
Perfect. Thank you so much. And if anyone wants to get connected with the Project Hope team, please reach out to CGI as well. If you missed the email in the chat, we're happy to make that connection for sure.
Becca, briefly, this is Andrea. Just wanted to add as well that those trainings are available in multiple languages. Currently, or in the very near future, it's already available in English, Spanish, French, Russian, Haitian Creole, Macedonian, Portuguese, etc. So it is available in a number of languages, and that includes the presentation materials. So often we'll do the training of the trainer, and then, for example, those trainers can then replicate the information in Haitian Creole in the country of interest to be able to cascade that down. down and, as Tom said, make it both culturally and linguistically appropriate for the healthcare workers in that country that are receiving the secondary level of the training. Thank you.
Perfect. Thank you so much for that. Really helpful to know. My second question that was submitted is for Dr. Ambert, which is a question about how Proyecto Patria incorporated telemedicine into the psychological support that you're providing to the communities, and sort of what was that process like?
No. Right now we are in the first phase of just starting with the protocols, training the graduate students in the protocols of how to deal, because this is a new service. Most of the time, graduate students give the service directly to the persons, and the supervisions also are direct. So we are in this first phase, just having a training and doing all the administrative technological process of contacting the services, the technological services. So we haven't started yet. We are inside the University of Puerto Rico, so it's just in the phase of doing the protocols. Right now, we hope to start with the line of help. Then in a second phase, we are thinking that we will start the telepsychology services. So we haven't started yet.
Perfect. Thank you for that. And we'll love to see how it evolves and how it goes with the telemedicine. It's great. My next question is for Melito Smith from St. Thomas East End Medical Center. And the question was, how have you managed to get PPE into USVI, into St. Thomas in your facility, just sort of with many of the travel restrictions and shipping restrictions and different things that have been in place?
Sorry about that. That is a good question. What we have done is we partnered with the Virgin Islands Department of Health, which is the lead agency for the Virgin Islands in the COVID response, who in turn were able to access through FEMA and the emergency stockpile and other assets that they have available to it as the state agency for our Department of Health, and in relationship with the CDC as well. So we were able to get our PPEs in via the state agency, and also in support with direct relief at a point early on in the COVID response timeline.
Great. Thank you. That makes sense.
Yeah, we also order, but we're not getting full shipments.
Yep.
Shipments are coming in staggered quantities, given the pressure on the supplies nationally.
Yeah, that makes sense. And so that folks on the call have an idea, to get the PPE to the Virgin Islands, about how long has that taken you all when you've placed those orders?
There have been about a month at least out.
Wow. Okay.
About a month at least out with the and then when they come, it's not the full order. It's a partial orders, given the stress on quantities.
Okay. Great. Thank you for that. It's
You're
really
welcome.
helpful. My next question is for Rob and his colleagues from Adaptive and their partners who are on the line with us. The question was, is anyone working that you know of on developing COVID-19 protocols for hurricane shelters? And how do you have thoughts on how to prepare those centers now before the post-hurricane outbreaks occur, like some of our speakers have alluded to?
Well, I'd like to see if Jason or Tim would like to respond to that first before I say anything.
Yeah, I can hop in here quick. So yeah, the guidelines that we developed are not specific to any certain type of facility. They're really meant to be able to adapted, whether that's new construction, potential like temporary tent facility, or a retrofit. And so what we have been doing with organizations, especially in the retrofit space, would be more of a hurricane shelter, is working with them individually on their spaces and then taking the best practices and principles from these guidelines, utilizing those flows that Rob was talking about, and then adapting to their space. So yeah, it's not meant to be prescriptive. It's meant to be expandable and adaptive to different circumstances, but the core elements of the guidelines will drive that.
And the only thing I would add to that is just again, keep in mind the flexibility. You know, you may not want to design an entire facility just to be a hurricane shelter. Typically, there's multiple uses of facilities that can be retrofitted into a hurricane shelter. So think about that flexibility and adaptability of space. And, you know, when the threat of hurricane season is over, you know, what does the hurricane shelter go back to? Or, you know, these facilities that you've identified in the network of hurricane shelters, how do you actually adapt them to be hurricane shelters during the hurricane season?
Yeah, absolutely. Thank you for that. That makes a lot of sense as well. Really appreciate that. Another question for Miguel from AmeriCares, which was, is the training that AmeriCares provides to health workers available in multiple languages?
Yeah, thank you for the question. Right now, those workshops are in English and Spanish. We have in Spanish and English. I just put in the chat my email, so if someone wants those presentations, or also, have a group and want us to give the presentation or train of trainers, just let us know.
Okay, perfect. We got one more great question, which was geared towards University of Puerto Rico, again, Dr. Ambert, which is, with the fear of COVID and the past few years of so much loss and distress with all these different emergencies that have happened, have you seen, this question has seen, or the person asking this question has seen people in other areas be reluctant to leave their homes or be afraid to leave their homes and take shelter during a hurricane? So I'm wondering, Dr. Ambert, is there anything that you're able to do through your program, maybe with other agencies, to prepare people to sort of feel mentally safe in taking shelter or responding to the hurricane?
Here in Puerto Rico, that's a good question, because after Hurricane Maria, we have the earthquake. So in Project Patria, we were working with the people in the process of being on shelters because of the earthquake. Okay. So we give services to group of people that were on shelters that maybe they have lost their houses. Right now, on the services we were doing, because of COVID, this has been a challenge to give continuity, because we were in that moment of giving interventions to people that were in shelters. We work with graduate students inside of the university. Yep. So that's why we are moving on this another phase of telepsychology services on distance. So this is a new challenge, how to work with people that they feel safe on the shelters they are. Because before the COVID, people were afraid of going back to their houses on the south of the island. And now with COVID, there's many people that are really anxious to be at the shelters.
Yeah, of course.
So the challenge is having the project reach those people again. Because of the COVID and the social distances, the services just for this month stopped. Yeah. So we are again having continuity of the services, but through our line of mental health service.
Yeah, absolutely. Thank you so much for that. And definitely there's so many ways that these that these different things overlap in many different complicated ways. So appreciate you sharing that information and that strategy. I just saw a comment from Tim from Construction for Change, working with Adaptive, emphasizing that the COVID-19 response unit guidelines are also available in French and Spanish for anyone who is interested in those. So we are just about at time today. There's a few questions that we didn't get to, but I've noted them down so that we can have those answered for you all after this call and can follow up via email. We'll also make sure to send all the PowerPoint presentations that were given today via email. And we will also make this recording available to everyone who is on the call today or registered for the call today, to ensure that you all can refer back to this information whenever you want to. And we'll make all of those resources available at the end of next week when we finish the full series of these calls. So thank you all so much for joining today. And I really want to take a special, huge thank you to our speakers today, who I think have shared so much actionable and really timely and helpful information with everyone. So if there's anyone that spoke or anyone else who participated on the call who you would like to connect with, please feel free to reach out to me, Becca, or any member of the CGI team. Our team's email is cgiactionnetwork@clintonfoundation.org, which is up on the screen here. And please feel free to join us, and really encourage you to join us for our next 2 and final calls of this preparedness series, which will take place Tuesday, June 9th, which will focus on resilient energy systems and energy preparedness, which obviously we all know has been a huge issue in the past and is a really key focus for this hurricane season. And our final call will be next Thursday, June 11th, and we'll focus on adapting response efforts, humanitarian response efforts to the context of COVID. So I think some of the questions that we didn't get to answer today will definitely be addressed on that call next Thursday. So we're really looking forward to that conversation, which I think we'll be able to cover a lot of these sort of tactical questions as well. So thank you all so much for joining. Please have a safe and pleasant weekend, and we'll be in touch soon.